You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Thomas A. Dorman. Dr. Dorman is the medical director of the Paracelsus Clinic of Washington. We've invited him on the program today to discuss the latest advancements in the treatment of back pain. Dr. Dorman, welcome to the program.
Well, thank you for having me. It's a pleasure to be here, and I look forward to an interesting half hour with you.
Okay, good. Now, before we get into today's topic, I mean, you've written books on the subject of this prolotherapy, things like that. I guess physicians travel from all over the country to attend your lectures. Is that correct?
I've been involved in this thing for about 30 years. You know, my background is that I was the son of a rich businessman who wanted me to go into business. And I wanted to go into medicine to help people. There have been many opportunities to focus predominantly on the rich and not on the health. And my focus in my whole life has been on the health. You might summarize it with a Hippocratic Oath.
Okay.
I was practicing as a cardiologist in California, and many of these people had pain in the chest and the back and so on, which was not due to internal organ disease, such as heart attacks. And that's what led me into an area of curiosity and interest, which later became the prime interest in my life and the main focus of research. This is what led to my understanding of orthopedic medicine, in other words, the management of musculoskeletal conditions by medical means as opposed to by surgical means. You know, medicine is organized as a surgeon and...
Now, you say medical means as opposed to surgical means. What do you mean by that?
Well, say, for instance, abdominal problems. There's a gastroenterologist and there's a general surgeon. Now, in orthopedics, there's an orthopedic surgeon and there's a vacuum.
Okay.
Dr. Syriax, 1929, England, started the concept of orthopedic medicine. Are these conditions always surgical, or can they be managed by medical means? And this has been rather neglected. There's been a black hole. And some of my colleagues and I believe we fill this hole. And I think there now is a solution to the problem of chronic back pain, whiplash injuries. In fact, anywhere in the body where the ligaments or joint capsules, where there are injuries, these usually have solutions by medical means. Now, I'm not negating...
Non-surgical. Because you're saying medical means. When you say that...
I mean mobilization and appropriate injections, non-surgery. Now, I'm not opposed to surgery. There are many cases where surgery is wonderful. And modern surgical technology is wonderful, but so often over-applied. And I think those of us who practice orthopedic medicine have the skill of making the diagnosis.
Okay.
I sometimes boast that my surgical results are 100%, but I'm not a surgeon. Now, how is that, you might say?
That's right.
Because I think that when I tell a person, you need surgery, he truly does need surgery. While the vast majority of people say who get back surgery are very often unimproved. And we have the solution to that. And the key issue is understanding the mechanics of the back, the mechanics of injuries, and knowing how to make a diagnosis. And I hope you'll ask me again in this program, but the key point is how to make a diagnosis. Yes, there's a great deal of skill in understanding the exact mechanics of the deformities which occur in the spine. These are subtle and yet very painful.
Moving on to today's topic, prolotherapy. How does it work? What is it? When did it begin? Let's start there.
Prolotherapy is a form of injection treatment where an irritant or a remedy is placed by injection into the ligaments. Ligaments are the strings which bind bones together and joint capsules and so on. They can be provoked into healing. Now, when you cut your finger, it goes through a process of inflammation and then healing in about 10 days. You don't need to cut something in order to provoke healing. You can stimulate the natural healing process. It's very interesting that prolotherapy is a pro-treatment. It's pro-healing. Most of what we do in general medicine is anti-inflammatories, antipsychotics, you name it.
Were you skeptical originally when you heard about prolotherapy?
I didn't believe it at all.
Is that right?
When I first heard about this, I thought it was clearly quackery, and I went out to prove that it couldn't happen. And the mentor who taught me said, you grow ligaments as you grow tomatoes. And I laughed.
You can grow ligaments.
You can grow ligaments.
You can grow tomatoes.
And you know, it's amazing. And it is I who've proven that you can grow ligaments. And we did that with biopsies in 1985.
At what age? At what age can you do this?
From age 5 to age 85.
Is that right? And you see it happening in your practice?
Yes, and I have proven it with histological specimens.
So when you first learned this technique, so you were skeptical at first, and then what happened?
Well, I visited some doctors who use this technique, and I use a common expression, fell off my seat. I was amazed because I was already a fairly experienced physician and knew the dreadful failure we doctors in general had in managing these chronic painful conditions. Patients referred to orthopedic surgeons, come back, doctor, I'm no better, year after year. I'd already been in practice for some years. And when I saw the results, I thought, I can't not allow myself to learn how to do this.
Define results, by the way. Just they're out of pain.
Pain goes away.
Is that right?
Life comes back. They can sit at work. They can do work in their gardens. They can lift. They can walk. They can run. Everything a person wants to do in his life. When you're crippled with back pain, these are the things you can't do. If you can cure a person in the course of 2 months therapy, I've had patients who've had pain for 40, 50 years whom we were able to cure in the course of 6
Is that right?
weeks.
Well, give me an example. Somebody has pain, 40 years. They go to you, and we've talked, and you said a lot of your patients that you're the last resort doctor in many cases.
I often use that as a joke.
Is that right?
I
Is
say
that
I'm a
true?
resort doctor.
Okay.
And then they say, resort, what resort? Last resort.
Last resort. So somebody has pain for 40 years in their back. Give me a scenario. What happened?
Lady of 55 came in to see me, jumped off a springboard, age 18, and injured her back by hyperextension injury. Was crippled, was unable to raise a family, needed a nanny to look after the children, wasn't able to work. At this age, 55, she came in because a friend had sent her in. All my patients come in by referral by friends and relatives. That I know you can't help me, doctor, but my friend insisted that you see me. 6 weeks later, she could do everything she wanted to do, completely pain-free. That goes back 30 years.
So what did
and
you
the pattern has been the same
So
year
what did
after
you
year.
do that was missed then? Help me understand that part.
The first thing is I examined and took a history and began and analyzed the mechanics of the injury when she'd fallen off or jumped off that springboard, the hyperextension injury, and how it distorts the mechanics of the spine.
Okay.
Then I examined her to see whether the findings confirm the impression I had from the story, from the mechanics and the pain diagram. Having found that the examination findings confirm it, I made a strategy, a plan of treatment consisting of mobilization, some people call it manipulation.
Manipulation, okay.
And then appropriate injection to the injured ligaments. And here is really a key point in what's called prolotherapy. You introduced me as practicing prolotherapy, and that is true. But I really practice orthopedic medicine, which is a dimension greater. The first thing we need is a diagnosis, and it's based on understanding of body mechanics, an understanding of the body anatomy, the nature of ligaments, and the symptoms they produce. The symptoms that ligaments produce are not usually understood by doctors in general. And putting this together is a clinical diagnosis. One of the disadvantages of orthopedic medicine is that ligaments don't image. You see, everybody bases their diagnosis these days on what the MRI, etc. show. But the MRI doesn't show ligaments properly.
Is that right?
You can't feel them. I'll give you a quick analogy. Suppose you're wanting to boulay down a mountain and there's a rope. How are you going to judge whether that rope is going to support you? You're going to take a photograph of it, or you're going to pull in it and see.
Okay.
Well, I feel the structures of the body mechanically. Learning the manual skills of how to feel the subtle changes within the body takes time and training. Anyone can learn it, provided they set their mind to thinking and training their hands to feel. They come to me with a pile of MRIs, and as they walk into the office with a pile, I know that these are not solving their problem.
So you're saying that most of the back problems today don't show up on an MRI?
No, they don't. You see, the key issues, like the analogy with the rope. One can feel it. It has symptoms. It has characteristic findings on examination. You know, we doctors are taught how to examine the heart, the lungs, the abdomen, and make decisions based on history and examination. And in the back, no examination. There is that vacuum again. And yet, by examining a back, when one knows how to do it, one gets really good information that tells the clinician.
You mean touching and feeling the area?
Touching and feeling and looking at the static position and in movement. It doesn't take very long, but one needs a fair amount of savvy in understanding what one is looking for. Like any trade, once you do it regularly, one becomes skilled at it. And there are only a few of us who've really learned this. And my point about orthopedic medicine versus prolotherapy, that the issue is not simply injecting the ligaments where they're tender, which is the style that was developed in the 50s by George Hackett, but the process of making a mechanical diagnosis of that anatomy structure of our body called ligaments. Ligaments are a source of pain.
So ligaments are where the pain is generated. You're
Ligaments
saying.
is the source of pain. Sometimes
in many cases, in all the cases.
I've lectured all over the world. I've edited books. I've written books about this thing. The first book that came out was this thing here 15 years ago.
Diagnosis and injection techniques of orthopedic medicine.
Yes.
This is your book.
Yes.
Okay.
And the key point here
this
is
a medical text. It's not for the lay
No,
people.
this is a technical text.
Okay.
I've written hundreds of articles for the lay public, which are incidentally downloadable from my website.
Okay.
But the key issue I want to make is that it's not as simple as injecting the ligament where it's tender, because the superficial ligaments usually cause the pain, and the deep ligaments are responsible for the mechanical dysfunction. And the sophisticated orthopedic physician is able to separate these. And yes, we treat the source of the immediate pain, but if we repair the mechanics, pain does not recur. And that is the beauty of these techniques, that we get cures. People get rid of their pain permanently.
Now, what if somebody's watching this? We have a lot of physicians that watch the program, and they're saying, you know, I've heard of prolotherapy, but this guy, this doctor, sounds like he's exaggerating, overstating the benefits of prolotherapy. What do you say to those doctors that are skeptical?
I say to the doctors that the gold standard for evaluating a form of therapy is a controlled study. There are 2 prospective, double-blind controlled studies verifying what I've just said, published in first-class journals like The Lancet. This is not quackery. It has not been publicized wisely for the reasons we alluded to early, but that it is established fact and based on scientific veracity. Go on Medline, look up the articles. I've reproduced them on my webpage as well.
Why do orthopedic surgeons, why are they so skeptical about this particular procedure?
I think mostly because it hasn't come to their attention. This is not ordinarily taught in residency for orthopedists, and I've had many orthopedists who've heard about it, had patients who've been cured, who've come to me and learnt about it with great gratitude. It's absolutely gratifying to have the experience of open-minded physicians come. I've used to, I don't at the moment, put on courses on this thing, and come and learn, go back to their practice and have the same wonderful success. I wasn't programmed with this from birth. I learnt about it from others, although I admit that it is I who did most of the research, and that it is I who wrote the textbook on it. But the basic concepts weren't mine. They were around. In 1837, the idea of provoking scarring to strengthen tissue arose from a famous Parisian surgeon called Valpo. This was taken over to America in the 20s and 30s. The first article on prolotherapy, then called sclerotherapy, and I'll allude to that in a moment, was published in 1936 by Earl Gedney from Philadelphia. This was learnt and practiced by the osteopaths. It came into the medical arena in the mid-50s by George Hackett, and he coined this term prolotherapy, which comes from growth and treatment, and it's a positive concept. We prompt the body into regrowing. If you like, it's like nutrition. With healthy nutrition, the body grows and is healthy. With bad nutrition, the opposite applies. And one of the reasons I moved to Washington is because in the Northwest is the mecca of understanding nutrition and toxicology. And I, by the late 80s, early 90s, by the late 90s, came to understand I knew how to diagnose and treat musculoskeletal conditions, but I didn't know why there's an epidemic of it. The NIH, the research institutions of America, are not interested in researching that. So I thought I'd see what I can find out. And I came to the understanding that a lot of it has to do with nutrition. And my practice.
So you're combining nutrition with prolotherapy?
My practice has become entirely holistic. And it's very interesting that the patients who seek me out are people who have been dissatisfied by, I'll call it, establishment medicine, and are looking for alternative techniques. I think they're not alternative. I think they're good medicine. And this actually falls into a whole gamut of areas in medicine, although my research and main focus is on this
So
issue
who's a
we've been
candidate
talking
then?
about.
Who's a candidate? People watch the program. They have back pain. We're talking about back pain today. Who should see you?
You know, I don't like the word candidate.
Okay.
I think candidate is somebody you vote for. The people who benefit, the people who come to me asking for help, are the people who have chronic back pain, which has not resolved by repeated chiropractic adjustments or osteopathic adjustments.
What about chiropractors? You work oftentimes together with chiropractors. Do they send you patients?
I love chiropractors.
Okay.
Chiropractors help millions and millions of people with severe malalignments in the axial skeleton. And it's a shocking observation that the medical profession doesn't understand, and unfortunately seemingly doesn't want to understand these problems. I was programmed at my medical university, don't worry about the pelvis, doctor. It doesn't move, it only serves in parturition. That is incorrect. The pelvis here is a little plastic model. I hope the camera can see it.
We can get that.
As we walk, the iliac bones toggle back and forth thusly. And one of the problems with the unique spine of the human being, because humans are the only truly biped organism, is that the sacroiliac joint locks on the stance side and swings on the other side, and this stores and releases energy. Now, I started my interest in why does prolotherapy work for back pain and why do we need to treat the deep ligaments. I ended up doing a whole series of research projects on the mechanics of the human pelvis, and some interesting things came to light which were quite unknown before. I might ask a physician, I won't ask you, you're not a physician, what does the pelvis do? And the typical answer is it's a birth canal, and that it's a device for hanging on muscles and ligaments. That's a wrong answer. The right answer is the pelvis is a mechanical transducer of the forces of locomotion. A human being in good health walking is more efficient than any other creature, much more efficient than a horse or a dog.
So knowing that, how does it relate to pain? And how do you treat pain?
We learned from the mechanics of the pelvis why it is that people are subject to this. The typical scenario is a person who has a fall, sometime later his back goes out, by which he means that he has sudden accession pain from an unexpected movement. He's very often deformed in posture and in severe pain. That can be corrected manually, but when it keeps recurring, the ligaments are weakened, and by prolotherapy, we provoke re-strengthening.
So these
these people are cured.
These people that their back goes out all the time, maybe a couple times a year at first, and then every 3 months, once a month.
Precisely.
Those people you're saying can be turned around, where their back doesn't go out anymore.
Absolutely.
Now you say cure. The Wellness Hour, we air nationwide now, and everybody's afraid to mention cure on my program, and I'm very careful to not endorse any doctor. I'm just asking the questions here.
That's
you
okay.
say cure.
That's what I mean.
And these people get cured.
Yes.
Back pain patients.
The statistics are, and the statistics are both from the 2 prospective control studies as well as several surveys, that 9 out of 10 people with chronic back pain, when diagnosed as having ligamentous dysfunction, emphasis, correct diagnosis first, I need to see the patient.
Right.
9 out of 10 either cured or at least 70% better and return to normal living functions. These are the statistics which have been confirmed time and again.
Okay.
Now, when I say cured, some of these are left with minimal residual pain, but it's minimal. They're functionally back to normal, and as far as I'm concerned, that's a cure.
Okay, we're going to take a quick break. We come back, some of your stories about people that have benefited, and more about the science of prolotherapy. You're watching The Wellness Hour. We're talking about back pain today with Dr. Dorman. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Are you in pain? Do you have back pain? If so, you've got to hear what Dr. Dorman has to say. Okay, back pain.
Well,
Give me a story of somebody that
Randy,
you say cured, that has been cured.
Yes, you asked me if I could produce a few stories,
Okay.
and at first pass I thought to myself that's difficult because all the patients fall into this category and it's become totally routine. But I thought about it for a minute, let me give you an example.
Okay.
A tall man of 6'5" is referred to me by a neurosurgeon who knew about my skills. He had had back pain surgery for a bulging disc, he was no better. He walked stiffly as if walking on eggs. So see in your mind's eye, little midget me, big giant patient,
Okay.
comes in, terrified to walk, terrified to stoop. In the examination I tell him, well, bang backwards as far as you can, 1 degree. Bend forwards as far as you can, 2 degrees. Doctor, I can't move. The surgeon told me that I might break my discs. He's been like this for 10 years. I had to talk him into accepting that I will mobilize him, talk him into accepting that he'll have these injections. We use light conscious.
Now, he had very little movement, but he was also in pain as well.
He was in severe pain.
Okay.
He was terrified. He drove from 2 states away. His wife drove him on the back seat of a camper. This was a terrible scenario.
2 states away to see you.
Yes, oh yes.
Okay.
I have people come from all over the world.
Okay.
So I had a lot of public relations things to persuade him, listen, I'll get you well, but you have to move, because the body's function is dependent on normal movement. Well, we went through the whole routine of diagnosing this precisely, mobilizing him. He had to sedate him. We used light conscious sedation in the office for the purpose. We mobilized him very vigorously, and this takes a fair amount of strength. This is not a casual manipulation like the chiropractor. We injected him with appropriate remedies.
Into the ligament.
Into the ligaments and the relevant site in the back. A lot of it goes into the posterior sacroiliac ligaments, which are represented here in these little bungee cords. And after the first treatment, he woke up from his light anesthesia and he said, now what am I to do? I said, stand up. And he stood up without any pain, and the expression of amazement in his face was so gratifying. And then I said, well, bend backwards, 5 degrees. Bend forward, below the knees. Within a week, he could bend all the way back and he could touch his toes. Within 2 months, he's cured. He's back to work.
How many treatments? I mean, 3 to 5 treatments?
There isn't a fixed number, but the typical average...
With him?
With this man, it was 8 treatments. This individual had had previous surgery, had a great deal of problem with the ligaments of his lower back, and he was very big.
So 2 months later...
He walked out. He'd been a delivery man in some transport system.
Okay.
And he was able to go back to normal work.
Now, what did he say to you? Does he consider it cured?
It was very embarrassing because there's little me and there's this very big patient. He gave me a huge hug. He was crying.
Is that right?
His wife had had a whiplash injury. No time at all he brought the wife in. And we went through the routine of treating her.